everyone. Good afternoon, everyone. Okay, it's a small room, so we need a little bit of energy. Welcome to the session on clean air as part of the right to the healthy environment. My name is Tallulah Oni. I'm a professor at Cambridge University and founder of Open Better, and I'm your moderator for the next what's now 45 minutes. They say he or she who adapts owns the future. So we're owning the future right now by adapting. We're going to have a really what I hope will be a really great discussion centering clean air in against the background of a healthy environment, right? So we know that this is not a standalone endeavor, but how do we make sure this is part of a healthy environment firstly, but also how do we ensure that this is very much tied to justice, right? Ensuring that when our efforts to address air pollution are focused on the most vulnerable and taking really a justice lens to our efforts. So that is what's on the menu for the next 45 minutes. We will have a testimony, and then we may have a setting the scene session speech. If we don't, we will go straight into the panel discussion. We've got some excellent panelists that will be joining us today. And so what we will do is, in order, I'd like it to be a little bit interactive and give everyone an opportunity to ask questions. So I will, just a heads up to the panelists and to you all, maybe invite brief questions as we go. So we're all on this journey together. So we don't run out of time for Q&A. So without further ado, it is my pleasure to invite Fanny Kuru Castro to give some opening remarks. She is the indigenous leader of the coordinating body of indigenous organizations of the Amazon Basin in Colombia and a Breathe Live voice. Please join me in welcoming her.
Okay, good afternoon, and thanks for being here. As an inhabitant of one of the most important ecosystems in the world, which is the Amazon basin and the Amazon biome, I would like to highlight the fact that we, the ones who produce oxygen and clean air, are the ones oftentimes most affected by external actions such as forest fires, deforestation, the degradation of the soil, illegal mining, monocrops that actually ravage the Amazon jungle, which has carried this ecosystem to a point of no return, as the president today said. And I coordinate an organization that encompasses basically a region of 9 countries, 7 million square kilometers that comprise the Amazon, and we have this huge responsibility of taking care of this ecosystem. And I believe that what we have to do is try and serve justice to those who inhabit those who inhabit sensitive ecosystems for the world. Congo, Indonesia, the coral reefs, the Amazon, all of those are ecosystems that are vital for the life of the planet and life on the planet. So that's what we have to support. Why do we suffer so much from contaminated air? Because there is a lot of forest fires in the Amazon, and that is a way of taking over the territory of the indigenous peoples, and the most conserved territories, those with clean air, clean water, are basically indigenous communities. But from the outside, we get all of these people taking over the territory, setting up monocrops in such a fragile ecosystem. There is livestock, cattling, monocrops. So there is no justice for us. Despite the fact that we take care of the environment, we're the most affected ones. And beyond that, as a matter of fact, our Amazon cities are not the most sustainable ones or the cleanest ones. We lack a territorial arrangement. The rivers become contaminated with all of the waste coming from the cities around the Amazon River. So contamination is a comprehensive issue. It comes from all different sides. Uh, when I burn plastic in the Amazon, when I dispose of garbage, I am contaminating the Amazon. Although the Amazon is vital, it is also lethal because when the Amazon becomes a flat plain, when deforestation reaches 26%, the Amazon may actually get to a point of no return. It may become a plain territory, and we lose out. We, the indigenous peoples inhabiting those territories. So I believe that amongst us, we need to breathe life because today we are breathing inequalities. Today we are breathing discrimination. Today we are breathing the absence of the governments because that is also a problem. The governments of Amazon states do not reach out to the peripheries, and we are the ones suffering from the inequalities, not only in the Amazon region, which in the case of Colombia, we call it the other Colombia, the Colombia that is not included into the government's public policies, the other Colombia that doesn't participate, that is not included in the construction of policies for a region that we can call our own. We have been included as of late. We have gained on some grounds with the government, but we still have a long way to go. So, setting up public policies for the Amazon is just not handing out money. We have to hand out money with responsibility. How are we going to do it, and how we are going to take care of the Amazon? So, I like to speak about the Amazon quite a lot and the work that we women do in the Amazon, all of this soil degradation that is done based on illegal economies coming from the outside, who actually who regenerates or restores those territories, all of those lands, all of those forests, and the river, which is contaminated by the illegal mining. It is full of mercury, but there is also this sick population who have been consuming fish from a contaminated river, a river polluted with mercury. That's what the Amazon is. It is a contrast of different things, and those of us who want to safeguard this strategic ecosystem for life, well, let's help women. Women are the ones sowing with their hands. With their hands, they restore the land, but their voices and their work are not being taken into consideration. There is injustice against women. From the outside, we become discriminated against. We are discriminated against due to our gender, and we also suffer on the inside. So I put out a calling to social justice, economic justice, environmental justice, life and clean air for the Amazon. The Amazon is for everybody and is the responsibility of everybody. Thank you.
Thank you so much, Fanny, for highlighting those critical points. So, one of the things, the three key things I heard from you there, we talk about air pollution being a transboundary issue, but from your testimony there, justice is also transboundary, and so the action needs to be transboundary. We need to think about intergenerational fairness because these are things that perpetuate and widen inequalities if we don't pay attention to that. And lastly, we think about inclusion, right? We talk about making air pollution, making the invisible visible with air pollution, but we also need to make visible the people who are most impacted and make sure that they're part of the decision making and they're actually driving the solution. So thank you for that very powerful testimony. May I check if Astrid is in the room? Okay. All right. So with that, we will move to the panel. We have an esteemed panel that I will invite as I call your name to come up to the onto the stage, please. We have Sunkaru Toure, who's the founder of Permian Lung Health Institute in the Gambia. We have Vanessa Lopez, the president of Health and Environmental Alliance. We have Elvis Ndikum, who's co-founder and president of a global youth strategy on air pollution and climate health in Cameroon. And we have Bavreen Kandari, who I think I saw, yes, co-founder of Warrior Moms in India. Do we have Louise in the room? Yes, we do. Oh, fantastic. We have Louise Mandalio, who is the General Coordinator of Environmental Quality in the Department of, may I ask you to move along a little bit, please? Department of Environmental Quality in the Ministry of Environment and Climate Change in Brazil. Do we have Harry in the room? Okay, great.
Yeah. Yes. All right. Okay. Try to put Astrid.
All right. Great. Welcome the panel. Let's warm you up. So we're going to take a little bit of a narrative journey from, picking up on Fanny's point about engaging different types of people. We know that having this justice angle needs strong regulation, needs strong legislation. It needs engagement with civil society, needs engagement with academics, needs engagement with healthcare workers. So we're just going to hear from the panel and from their different experiences and context about their approaches to this topic. Sunkaru, we'll start with you, right? So you're, and you may have heard his intervention a little bit this morning, but you set up an initiative to improve the air quality in the Gambia from the perspective of a healthcare worker. Can you zero in on, beyond the data collection, given that we need this legislation to move things along and ensure that they're equitable? How can you tell us a little bit about how what your initiative is and how that has influenced decision making in your context?
Thank you very much. Air pollution is a very. Go. Hear me?
Yeah.
Yes. Okay. Good. So air pollution is a very it's a complicated problem, and as I said earlier, I'm mostly a clinician. I practice at the bedside and had a simple clinical question: what is it that my patients are inhaling that's making them sick? And how do you go from that to building air quality networks? And now I find myself here among these very smart people trying to figure out how to fix that problem. It is very multisectoral. It requires a lot of collaboration. I think what we set out to do initially was to address the basic gap of no data to some data and a lot of data. And then now that you have that data, what does it mean? What are the causes of air pollution? And we've identified, and I tell people this, I think I know what the problem is, but I don't think that the solution is entirely what I can do at the bedside. It requires folks at different sectors, like in the energy sector, for example, or in the environmental sector, in education, public health, and also transportation, and also in the legal frameworks for enforcing legislation to reduce air pollution. We have laws in our books in Gambia to protect us from air pollution, but the enforcement of that component is not something that a physician does. I think there are much smarter people than me that can do that. So it just highlights the very cross-cutting nature of air pollution that requires breaking down the silos that we have. It means that physicians can get out of their white coats and feel comfortable talking to, atmospheric physicists. I know nothing about particle physics. So, but it's so important that we really collaborate in that. And I think that's kind of the perspective that we've had. So now that we have the data, we've set the perspective for us to then collaborate and see how best we can identify the local sources of pollution in Gambia, for instance, and then come up with context appropriate solutions from the ground up. So it has to really be a local initiative and then scaled up to a national level. And then we can learn from countries, because a lot of the challenges we have in many African countries are similar. We have a lot of similar challenges. So within that regional context, we can share best practices and we can collaborate across the borders. And that's the way it's done in a sustainable way.
Mm-hmm. So a couple of points you raised there, I just want to dig into. Firstly, you talked about the challenge of the healthcare workers communicating the different sectors, different approaches. So what is needed to make that, to enable that, firstly? And then secondly, what are your thoughts on ensuring that action then has this justice and rights-based lens?
Yeah, I think first of all, doctor speak is very it is not as comprehensible to a lot of people. And I found myself talking to a lot of policymakers and politicians, and they speak a very different language. They don't want graphs. The mayors in Gambia don't want to hear about, the PM 2.5. They want to know, how can I put this in my next budget? And is it going to get me reelected? Mm-hmm. And that's something I don't know how to do. But we need to get better at communicating science to policymakers. Mm-hmm. And I found I'm learning that myself. And I try to find out, it's called a WIFM. What is it for me? You have to find a WIFM in your partners, in the politicians, and say, hey, look, this is good. It has social capital, it has political capital, and it's good science, and it's good medicine. And if you can get that confidence and package it very nicely, you can convince them to actually sign off on it. That's how I was able to convince the government to allow me to install sensors in government buildings, and as a private entity. So just to give you a perspective. But also I think to the next point that you raised about the legislative part, we're going to need lawyers involved. You're going to get people like administrators from the parliament. We need to educate parliamentarians. Our parliament has a select committee on the environment and health. Well, guess who's going to be spoken to by them? Me and other people. So you have to talk legal speak too and understand what that means. And you have to be able to be really a multitasker and an agent for change in your local context. And it might not be the same in every country, by the way.
Mm-hmm. Great, thanks, Sankuru. So moving to you, Vanessa. So we're moving from that kind of communication and using ensuring that the data is translating into action. In your context, your organization has been a strong advocate for tackling air pollution as a public health crisis. Can you tell us, particularly in the European region, can you tell us a little bit about your experience on effective strategies to achieve the goals? That maybe tell us a little bit about your recent achievements and your reflections on strategies to achieve this.
Thank you. I'm going to speak in Spanish, if it's okay.
Indeed, one of the things we have to take away from this forum is that all the science, all the standards that the WHO has proposed, I mean, those recommendations have to be put into a regulatory framework that allows, that is binding and that can be updated and that includes some accountability. And here I wanted to tell you about the experience in Europe. This morning we heard that recently in December 2024, there was the approval of the new European Directive on Air Quality that has been a collective achievement. And it has brought the health sector, of course, and as the Health and Environmental Alliance, but that has brought other organizations that did not work collectively to come together and group under the European Health Alliance to drive this legislation, which is not what we really want, but it brings new standards that come closer to the WHO recommendations, and then it brings other benefits, such as recognizing the inequalities and the exposure to air pollutants and the inequalities and the most vulnerable, and the need to establish concrete measures. Now, forward looking, we can talk about that, but now we have to take this down to the countries. I mean, this European approval from this directive, that's the first step, but then now we have to do some political approach, communications, and exert some pressure in the country so that we can bring this directive down to the national legislations and bring it down to the regions and the local settings. Concerning inequalities, I think that is fundamental. And that's the title of this panel, of course. For example, the European Agency on Environment, in one of its latest reports, say that exposure to PM 2.5 is 30% higher in the poorest areas in Europe. I also recommend a paper, a briefing, where they mention with scientific evidence, cases in Barcelona, in Brussels, in Italy, where that is clearly shown. I think that's important because we have the evidence that in Europe, the pollutants, control of pollution has improved. However, the most vulnerable population, marginalized population, continue to be highly exposed to pollutants.
Think civil society can do to push to ensure that this regulation protects the most vulnerable? Because I mean, I think the achievements you described in Europe is phenomenal at the continental space, and as you say, it is now needs to be localized nationally. But what do you think civil society needs to do to ensure in that localizing it's actually the actions protecting the most vulnerable?
Bueno, yo creo que la sociedad civil aquí es
Civil society here is key, and I loved this morning to hear Javi Lopez, the secretary of the health department in Spain, because all this experience they have in environmental action in Brussels is that we are being attacked, and this is something very relevant to mention here. These very political issues, and I think there it's important to put the scientific evidence there in front of the politicians and the citizens. But I think it's not enough. I don't know what the recipe is, but I think there are certain private interests and people with different ideologies that are always trying to hinder our efforts. And as the president said, capitalism is there at the source of all these, but I think it's important to create networks of civil society, different constituencies, patients, scholars, scientists, and cross movements and advocates. And then I think recognizing institutions and political actors and the role of civil society is crucial. Now to close, I mean, not only with the legislation, but now we have to talk about the budget, and I'm talking about the European directive, but without the budget of the countries and the European Union, we're not going to be able to move on, and we still have a lot to do. We have to ensure that in the next program or the next budget of the European Union includes a budget line specifically to implement the directive and air quality actions.
The last quick question, because it's a good segue to Luis. Just going back to Fanny's point about the transboundary nature of this, can you maybe reflect a little bit on the role of civil society then in pushing to ensure that the ways that this legislation are actualized are not externalizing the issue to a different context, because you could address it locally and you can push to have that protect the vulnerable locally, but you could externalize, the issue elsewhere. So maybe just some reflections on that.
Yes, no, yeah, absolutely. You meant, pardon. Totalmente.
You have said it, and when we were preparing this panel, we saw how important it is. I mean, we can call them like transboundary accountability. I mean, it's not good enough if the rich countries have these legislations that are, high standard. If then we bring all these contaminating cars to African countries and so on. So we need, ethics on top. What we want for ourselves, we want it for the rest of the world, of course.
Thank you. So moving to Luis. Luis, I know that your country has a particular approaches. Maybe you can start off with that, as a way to segue us into how you see the role of legislation in your context.
Well, thank you. Hi, everyone. Yes, I think my colleagues have said good examples already, but I think it's important that when we design policies, I work in the Ministry of Environment of Brazil, so we design a lot of policies, normatives, regulations. So I think it's important from the start that these regulations are built considering and tackling inequalities. So it's important that we have participation in this process, but not only in a informative way of telling the people, oh, we are doing this, we are doing that, but since from the start to have working groups with the participation of NGOs, also the private sector. I think it's important to have democratic participation, but also this is only possible when you have a democratic government. Sometimes it's not often the case. Fortunately, since 2022-23, Brazil has a very democratic government, and it gives incentives for the participation of all the sectors. Let me see. Another thing that is important is to have to publicize the data that we collect. We cannot have our environmental data to be only stored in our ministry or government. We need to make them public so people can also check what is happening and make claims for the government to get better regulation. So in this sense, in Brazil, we have made a new system for receiving the data from the monitoring stations and publicize it with an air quality index, so people can understand better what is happening with the air quality in their surrounding areas. So we have advanced in this sense, but we still have a gap in providing the raw data. We are good informing the air quality, but not so good yet on giving access openly to all the data we have. So I think it's important to have these two sides.
So I'm going to ask you to play devil's advocate for yourself now. So, I want to talk about the topic of accountability, because you've kind of alluded to that. So given that you're on the government side, what do you think what are the strategies you think are the most effective in holding the government accountable to achieving these goals that you set out to do? Just so that people can take notes and
I know I have some ideas. I think it's important that also the government plans are public and constructed with participation and with goals and objectives that are accountable, that we can check during time if we are advancing or not, what are the problems. Also in Brazil, we are regularly doing annually report on air quality. So we are informing the population about how many stations we have, how are the data being collected, how are the levels of air quality we are seeing in Brazil, so people can check and also um, no-
Yeah. Yeah, no, got you. So that transparency is really critical so that people can hold accountable. Elvis, I'm going to come to you because you have, extraordinary experience in mobilizing the community and particularly youth in driving that accountability and increasing demand. So, from your perspective, can you share what approaches to just action looks like from your perspective?
Thank you very much. It's a pleasure for being here to speak on this issue on human rights, justice, and everything that concerns air pollution. I come from civil society perspective, where the, the regulations sometimes is not the way uh, we think. The civil society always at the position of a watchdog for government. So sometimes what concerns legislation, you need to be able to push this. But with the Global Youth Strategy on Air Pollution and Climate Health and my national organization, the Association for the Promotion of Youth Leadership, Advocacy and Volunteerism, uh, one of the things we did was really looking at the problem the way it is from the base, like how would the layman, somebody who doesn't go to school, will look at the perspective of you suffering, and you have to have a response, even if you don't know, because this where I began like looking at really why should people live with asthma? It doesn't have a cure and nobody talks about it. So this is the fundamental question. And sometimes these things come with how much legislation we have in terms of multisectoral response to certain issues. Uh, in Cameroon, for example, we have legislation for environmental protection, like you don't have to burn waste, you're going to pay this amount, but this is not enforced. So generally, government invest to overcome this gap. So if you come to Yaoundé, you're going to see so much waste. This is the reality. But government is investing a lot, which there is just a gap between legislation, how the Environmental Protection Act responds to waste management, and now how the people are responding to this. And one of the things we have been doing in the past years, and I've been pushing, was using the health argument to make people understand that when you inhale waste burn from the homes, it affects your health, and those who are vulnerable living with asthma, they suffer more. This is the underlying issue. People don't understand how even sometimes the waste might be a problem. Even the burning of biomass fuel, for like firewood, I'll call it simple. So it's about awareness. And one of the things we did, we ran a campaign with Global Action Plan UK, where we did with the Freedom to Breathe campaign. We had to call children who are asthmatic to speak out. So we did with the World Organization of Family Doctors, we did a training where we were training physicians in the hospitals and also really getting the Ministry of Health on board. And thanks to this kind of engagement, we were able to have the Minister of Health write my organization a letter saying, no, we want you to work, we want to invest in this, but we want to see what you can do at regional level, because I live in Yaoundé. So we got a collaboration with the regional delegate requested by the minister. And with this kind of collaboration we have, it was the first time that on the letter, the regional delegate said, yes, we want you to raise awareness on air pollution as a problem. And with this kind of engagement, we now started with when the International Day of Clean Air for Blue Skies came, which is one of the instruments that we can use to evaluate if we really want to consider clean air as a right for people. Because when the United Nations sits and thinks that the International Day of Clean Air for Blue Skies is important, it's because they have looked across all the countries, and they feel that the minimum level, there is no safe level for air pollution. Like the minimum level, what WHO calls minimum, can be at risk for some people. And when people know this, they know how they can protect themselves. And that is why we started raising awareness during this day. And we organized the first ever Clean Air Day in Cameroon in 2022, thanks to support still from the Ministry of Health. At that time, they had accepted the collaboration. And when we came, they said it was a good thing to start talking about air pollution and health. And the strength behind what we were doing was evidence. With this same ministerial department, they issued the ethical clearance when I was collecting data for the prevalence of asthma in the country, in Yaoundé. So when we came with this and the report, the data that was coming from the report of the prevalence really showing how the prevalence of asthma was high amongst children and adolescents than children and adults, and they felt like concern. This is just to say that we need to see the human right angle comes with really so much of awareness, which policymakers need to understand, and the public needs to accompany you. This is what I'm going to say. If you do this kind of human right work without having the public, like the WONCA, the World Organization of Family Doctors, helped me a lot, because the work we did with children in schools was guided by the fact that we were training them to go back home and tell their parents exactly what we were telling them in schools. And when they went back home, the parents felt motivated and they encouraged the children. And like when I do the International Day of for Clean Air for Blue Skies, I always have a child, an asthmatic child, and the parent. The both parents come, and when they come, she does the speech presenting her reality, how she lives back home, and now people understand the reality. And this is to say, this is why when the Minister of Communication came to our event during the second edition, still at the Ministry of Health, he learned about the evidence from our study, then also this testimony from this asthmatic child. It was very touching, and he reflected on his wife, who is also asthmatic. And that is why he has taken it a personal issue at the Ministry of Communication. This is nothing that their work doesn't relate with health, but this just to share this story that the health angle has a way of portraying the right to clean air in a way that people understand it. Because the right to clean air, people who are not like lawyers, who don't understand how legislation work, they don't feel it. So it's to say that in Cameroon, we are progressing. We are just at the beginning, but we feel we have something that when you are able to make policymakers to identify people in their neighborhoods, in their immediate family who suffer from health issues like asthma, cardiovascular, once they find a link with air pollution, then they pick it and they can drive the change.
Thank you so much, because I really appreciate how you framed accountability there, moving from just reactive in terms of being the watchdog to kind of proactive, and inserting, being a proactive part of the air quality governance, and ensuring that they're kind of playing a really critical role in shaping and driving. Bavring, I want to come to you now, and so moving from accountability to urgency, right, of this, because we're talking about a rights-based approach, we're talking about vulnerable populations. You've been at the forefront of grassroots kind of activism for clean air in India. What do you think are some of the challenges that you've experienced in terms of pushing that urgency, and what more do you think needs to be done to make it clear that this is something urgent?
Yes, of course, it's never been easy, whether it was with the government or with your own citizens, because especially when we talk of equity issues, when you are speaking about the masses in my country, in my city, who are actually battling much fiercer battles than clean air. So they don't know whether their children are going to get a 1 square meal in the evening. So clean air is way behind in their list of priorities. So that has been a very big challenge. And the elite thinks they can buy everything. So you can buy clean water and you can put purifiers, and that's what they think, that it's going to clean up air. So that's a big challenge, when you among citizens. And the same then, it's just in a different way with the government. Government is obviously, mostly they are in denial. And to prove them, of course, all this data, studies, now there is so much. I mean, I'm working in this space since 1990s, and it was a different world, and no one knew about it, and we didn't have doctors and scientists in my country. No one would speak about it. But now there is a huge, collective. There's everybody's talking about it. All these studies, these wonderful conferences, etc. So everything is being said, but then that one connect is always missing, because recently also this is the consecutive 6th year when we through the parliamentarians we raised these questions on how many air pollution deaths we had. So we get a clear reply of that there's no connection between air pollution and death. So in spite of, so obviously you rubbish Lancet and all these studies mean nothing. So then what is it when we're talking to each other and doing this, so it really means nothing, and then you're so disheartened and angry. But this has just become part of our lives now, that cynicism is also building and thing. But then, like you said, when you work with grassroots, you will not, and of course your own children, forget anybody else, because someone like me who's inspired by my own children and their health, and I'm worried about them. So nobody's more important for me. But when you see them, when you see these people, that you realize that air pollution is a very, very serious equity issue. It's not something that we can say that okay, I'll manage, or we'll be able to do it, because there's no choice. The underprivileged will obviously suffer much ahead than any one of us who's a bit safer. So when you are doing these various workshops, and I mean you do a lot of work, Louis, but we did a little research study, started doing studies in the slums and in the neighborhoods, not even slums, some, lesser privileged neighborhoods. So all those years we used to always have PPTs and some kind of, pamphlets, etc. But now we started taking monitors with us, the AQI monitors, and that was a game changer, for the people, because when you see it, you believe it. It's something which is very, very effective. I mean, I just feel even now for my media shows and all, I'm like, it's a joke. I always have a monitor in my hand, in my bag. I'm going to a wedding and I'm carrying a monitor in my bag to show you're breathing this air. So then Bhavreen will always have this monitor with her. And that makes even my own mother, I mean, I'm working for 25 years, and I tell her that when you cook in the kitchen, you open the window or something, but they won't listen. And suddenly one day when I put a monitor there, and it just rose from 2 minutes of cooking, it went from 110 to 600. So oh my God, it's really, I say, yeah, that's true, that's why I tell you. So it's something that has been a game changer for the whole issue. So this is the way we try to, I think that's time, so I'll let you go. Yeah.
No, that's really great. I'm going to come back to you in a moment, but I just want to get, if there is if we can get two questions that are to the point for the panelists, and then we round up. Oh, you're shy. Yes, we got one. Just as the mic is coming, I'm going to give the panelists, after we're just going to run through, and I would like you to think about one word or one phrase that you think is absolutely critical if we're to take, actually put this justice lens into action for clean air. So just a heads up.
Nice. Thank you all so much for your remarks. My name is Rachel Carl. I work at Oxfam. We are a global poverty and inequality organization in about 80 countries around the world. So very much appreciated the inequality focus of this panel. I wanted to kind of connect this to the president's remarks earlier today. He painted a really big picture on inequality, right? A provocative statement around our neoliberal systems, our multilateral systems, haven't delivered in some ways and have further entrenched inequality. And maybe we are living through the end of multilateral systems like the WHO. So I'm curious if you're able to zoom out in that way, how civil society and social movements can respond to that political reality and move, as the president said, from a multilateralism of institutions to a multilateralism of people.
Great. Is there any other question or comment? Final chance. Okay, that's the ping telling us there isn't. Who would like to answer that and take this as your final remarks as well?
I don't know if I will answer properly, but I don't believe in the end of how's the word?
Multilateralism.
Multilateralism. I think we are here today because we believe in it, and I still believe in it. I participate also in the Latin America Air Quality Network, and I will still be working with them. So maybe if we have major countries not wanting to collaborate and participate, we have others that will fill the gap. So I don't believe in the end.
Okay. And so your final remarks on what you think is absolutely critical for this then?
I would say is the collaborative approach.
Mm-hmm.
We will help each other, we work together, so we can go further.
Okay, great. Okay, so maybe let's start at the top there and just give you your final phrase.
Yeah, my final phrase will be, we need to look at the human rights approach with honesty. Justice is honesty. I feel there is a disconnect between even, I know what this cause is a difficult one, but we need to be honest if we want justice.
Okay, so approach it with honesty. Thank you.
So action, I was thinking now, so many study, data, everything. So plan without an action is a dream. So that's what we need. And then strict enforcement. That's what it is.
Plan without action is a dream. I like it.
For me, the keywords are open data and more collaboration.
Open data, more collaboration. So collaboration is coming through strong.
Yo creo que es muy importante.
I think it's important to make visible the impact of air in our health. That's not very visible. And also answering my colleague from the audience, I think is key to connect that with the economic model. I think that's the one that's killing us. That's creating inequalities, and we still have options to do it differently, but we need a hopeful message.
And connecting that data to health, connecting that data to economic productivity and development. I think with that, that brings us to the end of the session. The session was framed around taking clean air from the perspective of the right to a healthy environment, which is a United Nations right, because we know it's kind of clean air impacts directly and indirectly. The power of data for me has come through really strongly, but not just data for data's sake, but connecting it to health, connecting it to the human experience, making sure it's in the hands of the right people, building trust and really connecting to the human experience. I heard like the 3 A's that I heard that come through. There's the actors who is engaged, from the healthcare workers right through the civil society and through the people most affected, their agency, and ensuring that they have the data in their hands and they have the agency to act, and accountability, so that they're able to hold to account decision makers, both not just reactively, but proactively. A colleague of mine in Kuhn earlier yesterday talked about how we need to be thinking about, and to your question around multilateralism and power, and how that can, the challenges to power to address inequity and injustice, that we need to be thinking about moving from just thinking about global power at the global level or the national level, to recognizing that global power lies in the hands of global communities. And I think that was really powerful, because it highlights, we often think about community as hyperlocal, but we actually have a global hyper local community committed to justice, committed to intergenerational fairness, and committed to ensuring that the clean air is an actual, we have action on this to ensure it's a right and access to all. So with that, thank you all very much for this really great session. Please thank those panelists for me.